probably to continue with this question that Dr. Hassan made, and to reinforce, in part, you have answered the question I will do now.
Sorry.
But I think it's interesting because it's a condition that sometimes we can found here, especially here in Brazil, where the birds are raised on floor. So my question is, once the birds are properly immunized for coccidiosis, is it possible for the disease to occur at some point in life? So is there a condition that could trigger this occurrence?
Yes, as I said, effectively, some problem. If birds are immunized, if they are vaccinated, they should all be in contact with the coccidia. So it means that the majority of the flock will get immunized. If it's vaccination, and so they should not have experience or coccidiosis problem because they will get protected. But if there is an accident in this memory of protective immunity with immunosuppressive or immunodepressive pathogen, then you may experience some coccidiosis problems. So you have to be very careful about all the other diseases that can spread inside the flock. If the birds get immunized without vaccination, for example, birds are not vaccinated, but they experience a problem of Eimeria tenella during the 5th week. You may also have another problem with Eimeria tenella later, because when there is an outbreak of coccidiosis, hopefully not all the birds are sick and not all the birds are infected. You see that there is a problem. You see a certain amount of birds. That's why you bring the birds to the laboratory, and then you make a treatment. But maybe some of the birds won't have been in contact yet with these parasites. So the sick birds, they will spread some oocysts, they will increase the pressure, and maybe the other birds may eat large amounts of oocysts of Eimeria tenella, and then you see there is a new problem of tenella, but in fact it's not a new one. Other birds are infected and other birds get sick. The birds that got sick 1 week later, 1 week after, or 2 weeks after, these ones, they won't be sick again, unless there is an immunodepressive pathogen. But in that case, yes, you may experience several times the same coccidiosis problem, but in fact, this is theoretical. But in fact, I never saw 2 consecutive problems with Eimeria tenella or another species in the same flock. Most of the time, there is one outbreak with this species, but if there is another outbreak, it's linked with another species most of the time.
Okay, yeah, some situation that we have saw here in Brazil a few times is that we have vaccinated the birds in the first week, well vaccinated. Vaccine is everything okay. Um, we understand that the birds were well immunized, and then 30 weeks later or 40 weeks later, we have an outbreak. So we
Really?
think, well, why this happened? You know,
Mm-hmm.
it's something that we sometimes we question ourselves here to understand better, and until now we did not found the right answer to this.
I had one colleague that who worked on adenoviruses, and adenoviruses they might be immunodepressive, and sometimes without causing any problem in the flock. So they can infect the birds, they can pass in the flock, and they will decrease the immunity and the ability for the birds to fight against the
Okay,
infection,
okay,
and it could be uh, a non-visible infection with an immunodepressive pathogen.
that's fine.
But another thing, when you vaccinate, take care not to use a product that could kill the
Yeah.
vaccines within the first 3 weeks, because if you perform a good vaccination and nearly all the birds are infected and will develop the parasites, if there are no pre-life cycles and you use sulfonamides or you use something else that might kill the vaccine coccidia, then immunity will not um, take place and fully and correctly, and then you may experience some problems. But
Perfect.
I suspect more viruses and immunodepressive viruses.
Perfect.
May I add
Really clear.
another ingredient on the discussion? Because much probably what we are seeing or what we are learning that the people they are when they are facing cases like Gustavo mentioned, they
Mm-hmm.
look for the intestinal. They do the intestinal necropsy. So a necropsy look the gut, and they start to see some lesions or a disbalance. For example, gas. So there is
Mm-hmm.
some issue on the intestine.
Ah,
They
yes.
do a scrap and see a cyst. Oh yeah, you see, it's cocci.
Ah, oui,
Yeah.
oui, yes, yes. It might be a problem of diagnosis. Yes, also.
Yeah.
If it's really coccidiosis outbreak, okay, it might be an explanation with the use of product that kill the vaccine or immunodepressive viruses or something like that. But if it's a problem of diagnosis of mistake during the diagnosis, and it can occur, of course, and then it might be enteritis due to many other pathogenic agents. And of course, at that time, if you make some scrapings, you may find some parasites. Even if the birds are immune and fully protected, the parasites can still develop with very low level. So you may find some parasites in fully immunized birds. Yes. But the typical lesions, that's why it's important to look for the typical lesion and to make sure that these lesions, and sometimes it's when it's the petechia with maxima or brunetti, if it's really a problem of coccidiosis, you will find large amounts when you make some scrapings, and not only a few oocysts or a few schizons in the scraping. Yes.
Great.
The vaccination is not a tool to sterilize the environment. No, we are
No, 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 no.
keep
Yeah.
the infection controlled.
Yes, yes, that's why. To restore the balance between the development of the parasite and health of the birds. Yes.